everybody. What's going on? Welcome back. I'm your host, Michael Stamatinos with the Advancing Healthcare Innovation Show. And if you're new to us, we're just super pumped to have you here. Excited because we're bringing very incredible conversations, important conversations with leaders who are painstakingly shaping the future of healthcare. And we're really passionate about healthcare innovation, leadership, adoption, and opening up access to care. And if it's your first time tuning in, let me just tell you a little bit about what we're trying to do here. So we're focused on bringing stories of innovation to life. And the aim is highlighting real people that are truly innovating within our space and giving them the platform to be able to share their stories with our community and ultimately with the world. And we've got an incredibly action-packed year. If you haven't checked out any of the historical interviews, make sure that you hit the subscribe button now, wherever you are, just so that you can get any of the new interviews that come directly to your inbox. And our field is constantly changing. It's fast evolving, and it's crucial that we have leaders that can come on who can envision the future. They embrace innovation, and they're moving quickly to address pressing challenges. And our next guest on the show is one of these leaders. We're incredibly fortunate to have a true innovator within the space, Dr. Patrick McGill. He's the Chief Transformation Officer at Community Health Network. As a clinician, he cares deeply about transforming healthcare and is passionate about caring for his community. And he still treats patients one day a week. And when he's not seeing patients, Dr. McGill oversees population health management, directs value-based care initiatives, and develops data-driven strategies. And he manages both information technology and digital transformation, while also engaging with community health networks' use of analytics and to spearhead transformative efforts. So underneath his stewardship, the network has garnered numerous awards and recognitions, notably being named Most Wired for 3 consecutive years. Dr. McGill has also been named by Becker's as one of the top 30 most inspiring chief transformation officers. Dr. McGill, hopefully today, we'll delve into some of the insights and strategies that really drive transformational change, and maybe he can share a story or two where innovation and analytics converge to save lives and improve the caregiver experience. So, Dr. McGill, it's great to see you. Welcome to the show.
Thanks for having me. Thanks for having me. You make me
Yes.
sound a lot smarter than I probably am.
Well, that's my job. My job is to pump you up, to make you feel comfortable. And
Right, right.
no, but at the end of the day, it's about people, it's about innovating. How do you define innovation and transformation?
So I have this motto that I, kind of wake up every day, and I tell people if I'm not waking up every day making people a little bit uncomfortable, then I'm not transforming anything. So really my job in the network is to how do we drive things forward? How do we improve quality? How do we improve the patient experience? How do we look at the total costs of care? How do we look at the whole picture? And people always ask, well, what's your superpower? You always get that question too. And I think one of them is,
How did you know? That was one of my questions.
oh, I didn't know. Let's see, that's my superpower is picking out what the superpower question is. And so one of the things I always talk about is this kind of seeing horizontally or thinking horizontally. And that,
Right.
when you look at all the areas that roll up into transformation, we've got IT and analytics and value-based care, care in the home, informatics and a lot of that. It ties together because we're trying to think horizontally about how all these verticals come together to make things better. And so to answer your question about innovation, it's a lot of it's about change. It's not just change for change's sake, but
Right.
it's directed change. How do we leverage technology? How do we leverage data? How do we look at experience and really try and improve the overall sphere of care?
Hmm. And when you think about, I love it how you mentioned how you're making people feel uncomfortable. When you think about this, in essence, injecting that level of change, what do you think are some of those longstanding barriers that you've had to overcome as an organization? Some of those barriers to change. What were those initially?
Yeah, well, the one that we always talk about is healthcare is not um, traditionally very innovative or nimble or fast or agile. I mean, it's kind of a slow moving train that just kind of continues to plod along. And so I think having people think differently, that's one of the biggest barriers. You always get the question of, well, we've done it this way for many, many years. And if you think about the way care is delivered now, versus the way it was delivered 50 years ago or even 100 years ago. Except for technology and some of the new medicines and everything we still do, people
Yeah.
still go to the hospital, they still go to the emergency room, they still get admitted, either in the room, in the bed. And so there's been a lot of things that haven't changed, even though there's been some things that have changed in healthcare. And I think, asking people to think differently on something that they've done the same way for 20, 30, 40, 50 years is hard. I think it's also, but the flip side of that is I always often tell people there's healthcare also changes incredibly quickly as well. So
Yeah.
think about what all the changes we had with COVID. Everybody tightened up their boots and got the ground going with COVID. Think about all the new medications that have come out. Uh, the whole GLP-1 thing with weight loss. All of that's
Yeah.
brand new in the last year or two. So it's an interesting dynamic in healthcare because it's something that everybody thinks doesn't move very quickly, but at the same time, there's new developments and innovations coming out all the time. And I think that's one of the probably the biggest mindsets to shift as we're thinking about innovation and change.
Hmm. And talk a little bit about your team. Like how big is your team? And talk about sort of the context of the environment that you've set up to be a good facilitator of transformation to occur, for innovation to occur. Can you maybe share us some context? Because, look, you're not a big academic medical center.
Right.
I think there's some misnomers around, innovation and where it happens. Can
Yeah.
you maybe share some context about that? I
Yeah,
think
yeah,
that'd be
yeah. So
super
we're
helpful.
Community Health Network is a mid-sized health system based in Indianapolis, Indiana. We're like our name is community based, about 3.5 billion of net patient revenue, 16,000 employees. We have 850 people that work in the Office of Transformation. So that includes IT, analytics, pop health, value-based care, geriatrics, home care, hospice, palliative care. All of those areas roll together, and so I have a team of people around me. I have an incredible CIO that's been with the network for many years, and
Mhm.
does a great job of running a very efficient IT shop. I have analytics leaders who are very innovative as we're moving things to the cloud and thinking differently about generative AI and some of those tools. I have a chief clinical informatics officer who's actually a nurse who really understands those workflows, clinical workflows, whether they're nursing or physicians or other providers. Um, so I have a VP of Pop Health Transformation who's been in healthcare for over 20 years, a long time in home care and care in the home. Have a physician executive of population health transformation as well, who's been around for a long time. So, my goal is when you look at across all those areas, I'm a family doctor at the end of the day, right? I don't have
Right.
expertise in analytics and IT and some of those other areas, but it's surrounding myself with people who are knowledgeable, who are working hard, who are innovative, who think like I do. Um, but then my role is to enable them to get their job done and then get out of the way. So I think oftentimes you see some of the struggles in health systems is you have leaders who can't get out of the way and really empower their people to do what they're trained and what they're experts in doing. So that's what I think is the secret sauce for our team and why we've been able to be successful is, I'm there to break barriers and to fix problems, and I lean in hard sometimes. But most of the time it's how do we work together? How do I paint that vision and then get out of the way?
So it sounds like then some of your guiding principles are really around understanding where your limitations are, and then having the wherewithal to be able to not only just delegate a task, rather you're delegating authority for people to kind of lean into their superpowers, and you're really an obstacle remover. Are there any other guiding principles that you rely on to really
Yeah.
sort of navigate
I was just
this
talking about
complex
this one the
shifting
other
landscape?
day. Yeah, I
Yeah.
was just talking about this one the other day, transparency and communication. So we tend to have, we have a for example, we have a weekly meeting with about 20 to 30 people, leaders within transformation.
Yeah.
and it's a two-way conversation. It's topics that I need to bring to get addressed. Sometimes they're high level strategic, sometimes they're really deep in the weeds. It's also an opportunity for anyone in that meeting to bring things forward to me, barriers I need to break. And we solve problems very quickly before they fester or before they become bigger problems. And I think so transparency, frequent communication, being available to people, those are a lot
When
of
when you
a
when you,
lot
when
of
you
my
say
guiding principles.
transparency, not everything goes on track. Like, what happens if something goes on track? What, like, can you give, to the degree that you're able to, can you give a concrete example of what that looks like in terms of your leadership style?
When something doesn't go on track or is on
Yeah,
track.
when something gets off track, because
Yeah,
not
I
everything
think
stays on track. I don't, at
I
least not in
think
my
when things
world.
get off track, I think you create the channels to allow people to feel safe to raise the
Mm,
concern, right? So when something's
mm,
not going well, a project's off track, we either talk about it in that meeting and you've got all the people in there to fix it, or you bring it to me directly, or you bring it to your manager or whoever else it might be directly, and we solve the problem. I think
mm.
there's oftentimes people are like, well, if I bring this forward, I'm going to look like a failure. And I think it's actually the opposite, right? If you don't raise that concern that something's off the tracks that could be solved, I'll give you a real life example from yesterday.
Please.
So I had this call. It was with one of my analytic directors and one of our technical project managers. And we're in the process of transitioning our data warehouse, moving it into the Azure Databricks, changing the architecture. It's a 9-month project. They're right in the middle of it. It's on track. So you can imagine all the data sources and everything else that have to be re-architected and moved and
Right.
recreated. So they ran into a problem. And um, they had gone back to the business owner to say, "Hey, we're probably going to have to bring somebody in to help us with this. It's going to be, X number of dollars that we were unanticipating, and it was a small amount, it wasn't huge." So they brought it to me and said, "Hey, this is the issue, but we might be delaying the project. It's currently in yellow, or this is what we need to do to get it back to green." And I said, "Send me that's a no-brainer. Let's do that. We'll cover the cost as part of the project. Don't even put it on the business owner, because when they had gone back to the business owner, they were pushing back saying, I don't have that in my budget. I'm not sure that we can do that. I
Yeah.
said, well, let's put it in the project budget. Let's solve that problem. And within 5 minutes, a problem that had taken a couple of weeks, or they had been kind of bettering over it for a couple of weeks, we solved in just a couple minutes. So I
Yeah.
said, hey, in the future, bring those to me first and let's solve them before you kind of spin everybody up in the business. And then if we need to go to the business, we can do that, but we
Mm.
might have other solutions. And so I think that's a good example where when you run into problems, let's solve them. Let's lean in and fix them and solve them before they become bigger problems.
Totally. Totally. And in your experience, I'm curious because you mentioned a lot about population health. There's been a lot of, talk around value-based care. How do you see value-based care evolving? What role do you think will it play in achieving, higher quality care and better patient outcomes?
Yeah, value-based care unfortunately has become kind of this buzzword that means a lot of
Yes, I
different things
know.
to a lot of different people. And so, um, where have we been successful, or where we're not we as an organization, but we as a country have been successful? Quite frankly, it's been in the Medicare programs with Medicare, the ACOs and the next gen ACO and some of the Medicare Advantage, although that's now a hot topic with some of the
Yeah.
changes coming down from Medicare Advantage. But at least with that Medicare population, it's kind of, the rules of the road for the most part, and you can work around them. I think the narrative on value-based care needs to change and have people think about the total cost of care, which is really what we've tried to focus on. So whether you say that's value-based care or total
Hmm.
cost or high quality or whatever word you want to use, but it's how do you deliver the same high quality care at a lower overall cost? And I think whether that's pushing care in the home, pushing care out of the hospital, pushing surgeries to outpatient imaging, whatever that might be. It's how do you really start to look at the overall costs of care and deliver that same quality, same great experience at a lower total cost?
Mm. And when when you and your team are kind of gathering and connecting and getting together, where how do you prioritize problems, in terms of opportunities where you want to go? Talk about that process and
Yeah,
how you
we
kind of
have a
rank things based on
yeah, we
those
have a
prioritizations.
process that we've developed over the last few years where we tie projects that come forward to our network strategic priorities. So, um, and actually drive through our values. So we go through our values and ties a lot of the projects back to our values and then our strategic priorities. So, is there a growth opportunity? Is it equality and safety? Is it related to DEI or health equity? Is there a financial improvement? Is there a quality or regulatory compliance requirement? And so we start to, how many people does this project impact? Is it one department or an entire network? Is there a time savings attached as you think about the way people work? Is that time savings for one person or is it for
Mm.
many people? And so there's a whole hierarchy grid that we go through to start to score our projects and then put those in if you think about it as a 2 by 2 grid in terms of work effort and priority scoring, and that's really how we start to prioritize our work.
It's nice. You have a run it through a very simple matrix, and it's like, hey, what's a heavy lift, and what's going to give us, or what's a low lift that's going to give us high output that aligns with
Exactly.
that. Yeah, makes complete sense. You mentioned something around policy and compliance. I'm curious. I mean, how do you think federal and state policies are either supporting or hindering healthcare innovation, and what changes do you and the organization, what are you advocating for to foster this type of advancement?
I think that there's a lot coming. I think that, I was in a conversation earlier this week where there's a lot of unknowns around AI and where the federal government's
Yeah.
going to come in. And, there's been some state governments that have passed rules related to AI. And I think that's one that's to be determined, right? We're not exactly sure where the regulations are going to fall or land. And maybe they may not be in the near future, but the far around AI. I think the issue that we currently have with innovation in healthcare is you still have a fixed reimbursement schedule, right? If you're fee for service or even in value-based care, the risk reward for innovation is sometimes stymied. So you have because of that. So you have to really kind of take leaps of faith when it comes to innovation. Well thought out. So it's not just blind leaps of faith, but well thought
Right.
out about how do you drive, again, what problems are you trying to solve and how can technology or innovation or process improvement, process innovation really drive some of those improvements? So I think that I don't know that there's one law in particular or one
Yeah.
regulation or one policy that I would say that's really stymieing innovation. I think it really is going to take policy, payers, employers, patients, providers, everybody coming together to continue to support innovation and be able to support the ability to learn, fail fast, and innovate across the board.
You mentioned around your values, and as an organization, I'm curious, what does that look like when you're collaborating with payers? Do you sort of exude what those values are and sit across the table, or hopefully sit on the same side of the table to say, hey, here's kind of where we're at, and where are you? Like, talk about that dynamic, because I feel like sometimes it's kind of contentious. So I'm just sort of curious as to where you can kind of bridge that.
Yeah, so our number one value, our first value is patients first. And so, as we think about whether it's innovation or payer strategy or care delivery or quality and safety experience, whatever it might be, we always try and put it through that patient's first lens, patient in
Yeah.
the center of the care. And so as we're talking about a payer strategy that may or may not be patient centered or patient focused, you can think about some of the virtual care codes or virtual care platforms that may or may not be reimbursed, but are certainly better for many patients, but the payer may not be reimbursing them. I think that's the way that we can push back or have that conversation to say, both of us, payer and provider, let's put the patient in the middle and always remember that as our North Star about what's best for the patient, what's best for the care that they're receiving,
Hmm.
what's best to meet their needs, and let's work through a solution to with that in mind.
Hmm. I want to switch gears quickly. I
Sure.
was kind of going through your LinkedIn feed, and this segment of the show, I want to kind of bring up some of the things that you've posted, you've noted, and maybe even get some of your reactions to those and give a little bit more context.
Sure.
So I'm just going to kind of pull one up here. So this one was around exploring the topic of consumerism in healthcare. And you noted that the healthcare industry has seen a rise in consumerism in recent years, and the idea that healthcare should operate more like a traditional consumer markets with informed patients shopping around for the best deals on medical services. On the surface, this sounds like a positive shift toward patient empowerment. However, in practice, healthcare consumerism can lead to some unintended consequences. What are some unintended consequences?
Well, certainly one of them is the healthcare system is complex, and the difference is it's not like I'm shopping for the lowest price for something online or whatnot. There is a quality component to it that I don't necessarily understand as a
Hmm.
consumer. So if it's all about price, if you think about consumerism only from the lens of price, that's dangerous. If
Hmm.
you think about consumerism only from the lens of quality, I would argue, I wouldn't say that's dangerous, but that's ill-informed because quality is measured so many different ways that there's not a common standard for quality. So how do you have a trusted partner through a platform or somebody else that can help you navigate this quality, kind of navigate the triple aim, that price, that quality, that experience, that the reason I said it was concerning or dangerous or was that oftentimes people are not seeing all of those lenses. They're just looking at the one lens of give me the cheapest price.
Yeah, it's multifactorial. Totally.
Definitely.
Um, this is a quote. Technology is a useful servant, but a dangerous master. That was Christian Lewis Long, historian. Give me your reaction to that.
So oftentimes in healthcare, when we use technology just for the sake of using technology, it kind of becomes our master. And so all, what we really try and promote is when people come forward with new technologies, AI, new innovations, is to take a step back and say, okay, that is fine, but what problem are we trying to solve? We may have a process problem that has nothing to do with technology. We may have a education, a learning, a skill problem that has nothing to do with technology. And I think it always takes me back to the quote that you always hear about when we were implementing EMRs, that implementing an EMR did nothing except highlight and shine a big bright spotlight on all of your bad processes. So you have to go through some of those process improvements, standardization, everything else before you layer technology on. And I think technology becomes a tool, not a master. And that's why that quote really, really resonates with me.
And then who do you look to? What organizations do you look to that inspire you, or who's impressing you most now, whether they're individuals or organizations? Where do you kind of glean insights and fuel and I guess get fill your bucket?
Yeah, I have a number of them. I have a number of consortium groups, like-minded individual groups
Mm.
that get together periodically, and just the amount of knowledge. We're all thinking the same thing. We're all trying to solve the same problem. So the amount of knowledge and shared learning and free flow of information is always incredible. Um, I spend a lot of time in my current role with early startups, innovators, early tech companies, and it's a two-way street, right? It's we're offering something that they need in terms of a sandbox to really vet and
Yeah.
and drive their idea, and they offer something for us that we don't have that tech capability, that early startup, that really innovative ability. So it's a win-win. So I spend a lot of time around helping shape those early companies and giving insights. And
Awesome.
the advice I always give, and you've probably seen it throughout different posts and other things,
Yeah.
is I'm a I pride myself in being a lifelong learner, and there's always something new to learn. So whether that's from a person, a book, a podcast, experience, whatever it might be, never stop learning. And I think um, it's never been so applicable except today.
So I'm so happy when you brought up the consortium's comment. It was like a sign because I've been thinking about this. We share a mutual admiration for the author Sean Acor, who wrote a number of books, one of which is Big Potential, it's a good read for anyone who's checked it out. But he talks about sort of the power of leveraging networks to enhance potential. And how do you see the role of collaborative networks, whether it's, you mentioned this a bit, but including these partnerships with these tech firms and other health systems and other community organizations, whether, to enhance care. Do you see that taking another level? You mentioned sort of you guys being a sandbox, but give a little bit more concreteness to that. I mean, how early are you talking about companies? Are you talking about companies that are like a sketch on the back of a napkin, or are you talking about ones that have a little bit more maturity? Where on the scale are you with that, and what does that look like?
We're all across the board. So yeah, I think we've talked and worked with companies that are a sketch on a napkin to say, hey, we've got this idea, but is this a real problem? And how would this work in healthcare? How would this work in health systems? All the way to obviously well vetted, very mature companies. But a lot of them are in between, right? They have an idea, they have a minimum viable product, they have something to launch, but they haven't really fully deployed it or launched it in a health system. So how can we help them solve some of the problems
Yeah,
with adoption and integration and payment and what other problems are they not thinking of that their platform might be able to solve?
yeah. When I think about you sharing that, there's a 2 millimeter shift. You either you have to do it or you get to do it. And I think you've chosen to say, like, look, we get to do this work, and you have a robust team that gets to do it every single day in and day out. And it really boils down to the collaborative network. And you kind of been sort of doing it, but I think even creating this positive ecosystem, around you. And not only just you, but how have you and the team continued to foster that ecosystem within Community Health Network to really drive innovation and transformation?
I think it's really trying to help paint the picture for a bigger vision, which sounds trite. I get that. But oftentimes, and we learned this through COVID, oftentimes when people are working remotely, they work behind a screen, they're not laying hands on patients, they get disconnected from the mission, vision, and values of the organization. And at community, we call all 16,000 people caregivers. So whether you physically lay hands on a patient or not, you're doing something to drive the organization and to allow people to lay hands on patients or do a surgery or whatever it might be. And so this really came very clear to me during COVID.
Right.
As people were working from home, they became very disconnected, and we started to hear that I don't understand where we're going. I don't understand how this project I'm working on drives the network forward. I don't understand how this ties to our strategy. And so we've been very intentional over the last 2 years through communication, through town halls, through podcasts, through other communication channels to really be intentional about tying the work that we do in transformation to
Mhm.
the overall strategy, vision, mission, values of the organization. And I feel like we just recently had our engagement survey results come back. I feel like we're actually doing well. We're making traction, and people told us in the engagement survey they understand the work that they do ties to the overall network strategy. So I think for leaders, I think you have to be very intentional,
Yeah,
and especially in today's current work environment, because it's very easy to let that slide.
totally. So for those that, have tuned in, we typically ask like our last question, which is, we're all about taking action here. We can't just sit around and listen and not do anything. If there's one thing that you think anybody who's listening to this can take and implement, what would that be?
I would encourage people to listen to their teams, and I think it's not about sending out a survey. It's not about you know uh, doing other things, but truly try and lean in and understand the problems that are trying to be solved and do something about it. And I think um, again, goes back to what I was saying about that weekly meeting. That is a display every time something comes up that I have to address. That's a weekly reminder that I'm
Yeah,
here to help you, right? I'm not here to micromanage you, but I'm here to break barriers. So I would encourage people to listen, learn. There's always something to learn, and then lean in and take action when you can, and be
tremendous.
authentic about it.
Yeah, there's a few buzzwords that you use, not just buzzwords, but just words that you use that stuck out, intentionality, transparency. These are all things that leaders ought to do. They often don't, but there's a lot that do. And it's nice to see an example of one that's doing it, that's putting it into practice. So I just want to say thanks for the work that you and your team are doing. It's important work. And it was great to spend some time with you today. So for
Yeah,
those
I
that have tuned
appreciate.
in,
Yeah.
yeah, of course. So for those that have tuned in, if you found this particular conversation to be useful, let us know. Let us know what you like about it and engage with us. Share it with your communities, share it with your networks. It's always helpful. So until the next conversation, Dr. McGill, thanks again for coming on. You're always welcome to come back
Thank you.
again and report new things. Um, See you soon.
I appreciate it. One last thing I got to say is I am lucky that I get to do these things, but the real credit goes to the 850 people that work in the Office of Transformation, or the 16,000 people. They are what drive this work forward.
Well, guess what? I'm happy to have them come on to the show to
Well, I
share
will.
what they do too, because it's, like you said, the leader doesn't get all the credit. And it's nice
Right.
to see that you're sharing that with your team. But yeah, we don't mind having folks that are literally in the trenches, even as small or little as it may be. That little thing compounded makes a really big thing happen.
Absolutely.
So yeah, happy we can talk offline about that. But thanks again.
Yep.
Appreciate you.